Good afternoon, Faith. How are you?
Fine, thank you.
Hi, guys. Today we are here with Dr. Faith, and we're going to talk about mental health issue of her choice. And as you know, Dancing Brain, we start with fun, then we finish with a little talk, and then we finish with fun as well. So today we're going to have Faith, and she's going to tell us more about herself as we start this session today. Welcome, Faith.
Thank you so much, Lynette, for having me and for opening up your home, and especially for inviting me to the Dancing Brain.
I'm glad you came.
The Dancing Brain is something you must try. I thought it's going to be really light dancing. And then I realized, oh my God, I need some fitness lessons here. But it was really wonderful because other than just keeping fit, I feel like I'm, much happier.
Yes.
Yeah.
And by the way, that's what exercise does for people. You know, the feel good hormones. It helps the feel good hormones, and
Yeah.
then you feel happier.
Yeah. So as Lynette mentioned, I'm Dr. Faith. I'm a medical doctor by profession, and we've known each other since childhood. So sitting here at this table and doing something together is really exciting. And I must say, I'm so grateful because Lynette, you've been doing a great job in on your health campaign for the Mazira Foundation. I am the founder of the Mazira Foundation, and we have an objective of making sure that people have the knowledge that they need so that they're able to own their health. So Lynette has been doing quite an amazing job on mental health. Yeah, and today, while we're taking a break after the vigorous exercise, I was just talking to Lynette about my experience with COVID and how it was really overwhelming, not only on our physical health, but mentally.
Yes.
And I feel that I feel much better actually after talking to you. I think I just needed to talk out.
You need to give me money.
Definitely,
Yes.
definitely. Yeah, but this is a very wonderful initiative, the Dancing Brain, and maybe you could also just enlighten everybody about the Dancing Brain. I know you mentioned it to me, and I was really overwhelmed. I said I must be part of this. So thank you so much for having me.
Thank you. Dancing Brain is a part of Optimum Life Choices. Optimum Life Choices is an organization made by female psychologists, and our main aim is to make sure that people know about mental health. And we thought that the best thing we can do about mental health is disseminate this information to the very lowest of the low and to the highest of the high. And then again, one thing we want to do with the Dancing Brain is many a times I know you've noticed when people are talking about mental health, it's seriousness. People in suits, people looking like, this is a very serious issue. And knowing that mental illness has a lot of stigma. I thought that the best thing we can do is to start destigmatizing. And the best way to do this is do a dance, which is an exercise, and exercise is good for the body. And then second, talk about it informally.
Yeah.
Let it just be informal. Something 10 to 15 minutes, and we are done. So that people start knowing and they get curious to know what is it that this dancing brain is all about. So we want your brain to dance. You are all welcomed to join us. One thing about the dancing brain is, as much as we're doing the dancing brain, is also for funds collection for some of our people that we noticed needed more than mental health. And everybody I dance with, like Faith today, is going to give me 1,000 shillings. And then after that, she's going to transfer this to an M-Pesa. We're going to give her the pay bill. And then after this, she's going to rally some 10 of her friends who can give 100. We want it to be short, simple, and precise. So welcome once more, Dr. Faith, and take it away.
Yeah, so like you've heard, I am going to be giving in my contribution, and I'm going to be coming after you for the 100 shillings.
Oh, yes.
Yeah, but I'm just curious to understand, how did you think about this dancing brain? Because I think just the fact that you've danced with somebody, somehow the barriers go down.
Yes.
And you have a very interactive moment. And is it something you can do with some of the people who are going through mental difficulties? Do you think that could be one of the areas in which you could use that to break the barrier? Most of the time when you're sent to a psychologist or a counselor, you already feel like you have a problem.
Yes. In fact, you remind me, the time I was talking to my trainer, you met him saying,
Yes.
the first time I told him, he's like, so you're reading my mind? I'm like, my dear, no, it has nothing to do with reading mind. It just has a lot to do with, okay, we are good at reading body language. And at the same time, what you tell us, we really listen, and we listen keenly. Apart from listening to the words, we listen to your body language. And everything you do with your body is really an indication of what could be going wrong or what is going right. So yes, I'd really want to include this therapy for my people. When people come for therapy, I'd really love to do sessions. Apart from the sessions, sometimes I find myself doing with them some exercises. These are just mental exercises that can also help them. And of course, we give people homework so that you go and do, and especially it's on thoughts. So that works. And yes, if my clients agree, I think this is one of the best way that we can also break barriers. Yes.
No, I think so, because I didn't realize that mentally I was really tired with everything that has been going on. But trust me, I wouldn't have been comfortable coming and telling you, Lynette, I think I need to talk to you. I think I need help. But you see, the moment we danced and we sat after the dance and we were just having a discussion, it was very informal, and without knowing it, I was already opening up.
And I loved that.
I was already opening up and telling you, how I was feeling. And yeah, it didn't really feel like a session. We call them sessions, so you feel like it's really something so serious. But I really love that concept. And it's something that we need to think through very well.
Yes.
Because I know for a fact, as a doctor, that most of the metabolic disorders are as a result of an underlying mental issue. And anybody who is struggling with hypertension, with diabetes, with obesity, as much as you are on treatment, I think it is really good to try and find what triggered these conditions. And because most of the time I've realized that when we start having a discussion with my patients, they've actually had a traumatic experience. And during that period, then they realize that they start either gaining weight, or that's when they discover they have hypertension or diabetes. And so research has actually confirmed that most of these conditions are attributed to mental illnesses.
Yes.
Yeah. So I think this is something that should be taken seriously. And now with COVID having come up too, and it has really caused havoc.
Yes, it has. Now, talking about COVID, can you please tell us your experience? What is it that you went through, and what were the mental challenges that you're seeing where thoughts are concerned, and just how to cope? How was it for you?
I think the biggest shock was being told, actually, we've all tested positive. My husband, my son, and we stayed with my sister Wema and myself, we were all tested positive. And research has already shown that the teenagers and the elderly are not doing so well with COVID. They're not coping so well. And I already had 2 people who are in the risk category. So every morning waking up was really difficult, because I do not know who has made it through the night. And so you're in your room and you're trying to listen up. Has everybody woken up? And yeah, but we thank God that we actually went through it. But I feel there is, we missed the counseling part. We were not counseled through, being told you're COVID positive, and during that time, I had colleagues who had tested positive. A few of them, unfortunately, had passed on. So I think we need to do a lot more on counseling people through.
Yes.
Yeah, when it comes to COVID, and also just supporting them, especially because I was sick, but I was still supporting other people who would call me and tell me I've tested positive. How am I supposed to handle it? So it was really overwhelming because I was a patient. I was taking care of my family who had all tested positive, and I was also supporting other people who had tested positive. And because we had gone public um, about our situation, so we had many people calling in from all over the world actually, and I'm happy that I was able to assist them. I just didn't realize how much it had affected me psychologically.
Yeah, and the reason why I think this affects people is because we have primary emotions, and the primary emotions that you had here was fear. Especially if I hear you right, you are like at night people have slept, but you don't know who's woken up.
Yes.
In fact, I remember what you're telling me about sending junior AD to go to go and see how the senior AD has woken up. Yeah.
Yeah.
So if people don't manage this fear, it can easily lead to anxiety. But thank God, being that you're a medical doctor, you are able to manage this. But you can imagine someone who has no knowledge whatsoever, and then there's fear, and then you don't know what to do, you don't know how to control. I think no matter what happens, I think for COVID, it should be good if counselors are put in place. And you're saying that when you're going for testing, there was no counseling.
No, there was no counseling. Um, uh, when we realized that this is something that doesn't make sense medically, together with our physician, he said, this is COVID, we need to rule it out. So, of course, you're going there and you are thinking it might or might not be, but most probably it is. But there was no really counseling. So when you still hold on to that hope that it is not COVID, considering that we had done everything that we felt was needed to be done to protect us from getting COVID. So it was you still hold on to that hope that it might just be something else, because even the symptoms are really, they're not really specific. Sometimes it feels like malaria, it feels like typhoid, and we had traveled to Kisumu, so a number of times, so we were still hoping maybe it is malaria or something else. Yeah, but when you're told it is COVID, you think of everything.
Wow.
You think of everything because it is something new. We are not very sure about the treatment and the outcome. So all sorts of thoughts run through your mind. And when you talked about fear, I think at night, especially when everything is so quiet, I tell my friends, and it's more of a joke, but it's serious, you can hear your body speak.
Wow. So what was your body telling you?
Your body is telling you, okay, now the virus has moved to your lungs. Okay, now you are actually, developing difficulty in breathing. So you start experiencing symptoms, not because that is actually what is happening, but you're imagining those symptoms. And you're guided by the fear, yeah, most of people have difficulty in breathing. So yeah, maybe that's what I'm actually experiencing, And I don't know if everybody else who was had an experience with COVID would speak the same, but I had the fear of if I sleep, I might not wake up.
Wow.
So I would keep myself awake. And many people, if they were keen, I would be on social media mostly around, yeah.
I noticed that you used to send messages. I'd look at, This one at 2 a.m. you're sending messages. What?
I was
Okay.
trying to keep myself awake
Mm.
because of that fear of sleeping and not being able to wake up. Yeah, but because I did that for a number of nights, by the time I was feeling much better, I had really bad insomnia.
Yes.
Yeah, because now my body is used to being kept awake.
Yeah, by the way.
Yeah.
I think that happens. And those are things that maybe if you had a therapist, they would have taken you through. This is what fear can cause. And you know, sometimes in therapy, it's not much about what you will do or say, but just telling you what to expect, helps you manage those things.
Yeah.
So, like, if someone told you that, your body sometimes will talk to you and tell you you are breathing like this,
Yeah.
and you keep on listening, and that listening makes the symptoms worse.
Yes. Yeah.
So, Kai, I'm so sorry for what you went through, but I'm very glad. I remember from the very beginning, I was telling you, I am so glad you're speaking about this. Because at the end of the day, we need to talk about these things.
Yes. Yeah.
And tell me, what happened when you recovered? Your neighbors, how did they receive you?
The interesting thing is, we actually realized that many people in our estate had actually suffered, but everybody would keep quiet because of the stigma. So when we came out and told our story everywhere, so people started sending us messages and telling us, actually my wife is sick, or we just recovered, and you'll be fine. It was really encouraging how they took it. But of course, when you meet somebody and they remember that you just recovered from COVID, they immediately look for their for their mask.
I should be doing the same, huh?
They immediately look for their mask to put it on. But that is understandable because you don't want to take chances. Yeah, with COVID, you don't want to take chances.
Yeah, that is true. As much as COVID is there, we still need to sanitize. We still need to wear our mask and keep distance. But we also need to not put so much stigma on it, because as we see, even in news, many more people have survived than the people who've died. So it means at the end of the day, our fear something might happen, but then again, you look at it. Once you're born, you will die. For me, that is what has kept me going, because I tell myself, if my time had reached, somehow something will happen and it will reach. And I think that has been comforting to even some people that I talk to, and I tell them, pray, because if your time has not reached, it will not reach. So I'm so glad, and I'm very happy that you guys actually came out to talk about it. And if many people would talk about this thing, I think the stigma will be over. Like, look at HIV/AIDS. When it came, there was so much stigma. But nowadays, you have cases where you go somewhere and someone tells you, hey, it's lunchtime, I must take my drugs. And you're like, yes, this is what we should have. So I'm thinking that even if people would get COVID, just know what to do. Look at people like you who have experienced it, and also look at the preventive measures. I think that would help.
Yeah.
Okay, so what has been your experience with mental health? How have you viewed mental health, and what do you think we need to improve where mental health is concerned?
I think the first thing is we have taken mental health very lightly as a nation, and I think that is one thing that we really need to work on, because life is difficult, isn't it? Especially at this time, life is becoming even more difficult, and many people do not know how to deal with their emotions, and especially those who are introverts. Yes, they might not really know how to cope, with their emotions and everything that's happening around them. I have become very sensitive to, like, I follow my friends, I see how they post, what they post, and I'm very keen to notice a shift.
Yes.
And I think as a community, we can really be our brother and sister's keeper by being sensitive to the little things, that the subtle communication coming from people.
Yes.
Because sometimes even the person doesn't realize that they are having a challenge dealing with their emotions. But if you are very sensitive and keen, then you will be able to help them better.
True, true, true.
Yeah, and the other thing is we shouldn't look at it as something strange and weird. We shouldn't give them a name, that makes people, shy away from seeking help when they need it.
Yeah, that's true.
Yeah, and I think that's something that we can work on. I love the idea of the dancing brain.
Thank you.
Because it makes it sound fun, actually. And you relate dancing brain and then with mental health.
Yes.
Yeah, I mean, it makes it look like something, so ordinary. Yeah,
We have
and normal.
Yes, we will have to make it ordinary. We want to make it something that everybody would talk about. Because you realize that, as you're saying, the metabolic diseases, like you said, about high blood pressure, diabetes, and what else? Obesity. Many people would go to the doctor so many times. You're forever going, you're forever paying money. But do you know, if you manage your mental health, you will be much better. And I've seen it actually working at AR clinic where I am, and also at Dr.Faith is here. They have now learned that when people have high blood pressure and they cannot find out what is the underlying cause or something like that, they bring them to me. And as you said, most of the times it comes because of post-traumatic stress disorder. When someone went through trauma, you realize that they are carrying that trauma along with them. So in everything you do, that trauma is basically present. It's like some demon sitting on you. And then you start finding, your thoughts. And that is why when someone has a problem, they might not realize. Because one of the things that mental illnesses do is to affect your thoughts. So, if you're not thinking right, there's no way you can seek for help.
Yeah.
But I love what you brought about that. Friends, sisters, we need to be our brother's keeper.
True.
And start telling them, like, look here, I learned this and this and this, these symptoms could mean that you need to see someone. And I'm hoping that people will be open enough to start seeing therapists, because that way you'll even cut, sorry, you're a doctor, but we want to cut we want to cut our visits to the doctor at up to a half. Yes, because there are some things that you realize you can manage. Yes.
And when you talk about trauma, it is not only the very big, like historical trauma and something really major. The trauma can be as simple as you were sick and felt isolated.
Yes.
Or you were going through a difficult season in your life and your friends they were not there for you.
Even family.
Yeah, or family. So we shouldn't look at it, because sometimes when you say trauma, people really try to dig through, like what trauma? I haven't experienced any trauma in my life. But it can be those simple things that have really affected you.
True, yeah. And you find that, like, when you talk about people who become a bit bigger, I've noticed that sometimes it is because of bullying. Yes, someone was bullied when they were young. So that causes you to be stressed, and sometimes when you're stressed, you eat a lot. And then, of course, now weight gain will come.
Yeah.
So yes, let us look at the simple things and look at how is it that we can do this.
Yeah.
Okay.
Yeah. I mean, I joke about how I gained weight, especially during this COVID period. Yeah, it's something that you work through it, but it should not eat you up.
Yes.
So I find it easier joking about it.
Yes.
So you'll realize lately my posts have been about what is going out of control in my
Yeah, true.
Yeah, so again, thank you for inviting me, because at least the dance. Now I'll keep up with it.
Keep dancing, my dear.
Yes, I'll keep dancing for mental health and also for my own fitness.
Oh, keep dancing, my dear. And thank you so much also for taking mental health seriously. Very many doctors believe that many things are patched up by medication. But for a doctor to come out and start saying that, guys, look here, we can do things differently, I think that is a big thing. And I'm very proud of you.
Thank you.
Thank you, guys. We want to make this as short as possible. So we're going to have our next dancer, and we're going to tell you the topic we're going to talk about. For now, goodbye.
Goodbye. Keep safe.
Keep safe and keep dancing.
Yes.